Shanice, are you okay?
Yeah, I'm just having a weird sensation in my pinky finger. Huh, that's a little weird. I'm sure it's nothing. We need to talk about heart attacks or myocardial infarctions right now. Myocardial infarctions or heart attacks is one of the number one killers of Americans. And it continues to be so because we have a lot of risk factors for having heart attacks. One of the biggest things that we need to talk about is hyperlipidemia or cholesterol. Americans have high cholesterol. Sometimes that can run in families. There are genetic causes of high cholesterol. And there are also food factors that cause high cholesterol. So eating a lot of fatty foods can increase someone's cholesterol. There are medications that can reduce this risk and reduce overall cholesterol to reduce your risk of having a heart attack. If someone has a history of high blood pressure, hyperlipidemia or high cholesterol, and diabetes, these three things can really increase the risk of having a heart attack. There are other causes of heart attacks, such as really bad infections can sometimes affect the blood vessels in the heart. But if someone is having a sign of a heart attack, in addition to crushing, what we call substernal chest pain, so the pain that goes right under the chest, some people might have like a sudden onset of shortness of breath or feeling lightheaded or dizzy, or sometimes women may have pain radiating down the left arm. Those all might be signs of a heart attack. In the case of any of these symptoms, it's best to call 911 and go to the hospital immediately, especially a hospital that has a cardiac cath lab. And why is that important? Well, the sooner you get to somewhere where they can open up the blood vessels in the heart, the better outcome. So patients do a lot better when we can open up their blood vessels sooner. Usually within 90 minutes is what we're hoping for. If you or a loved one has any symptoms of a heart attack, please call 911. Let's hope that we never get there by trying to do everything we can to minimize those risks. So make sure you ask your primary care doctor about your cholesterol, your blood pressure, and to check your hemoglobin A1C to see if you have diabetes. Thank you.